The opinions expressed are those of the show's host and not the staff or management of Port St. Lucie Broadcasters. Any reproduction without written consent of WSTU and WPSL is strictly prohibited. Now it's time for Quality of Life Radio, brought to you by Cigna and Aetna Medicare. Here are your hosts, Gary Owen and Tom Bouvier.
Hello and good morning, everyone. Thank you for tuning in on this beautiful Tuesday morning. It's August 15th, 2023. I want to thank you for listening in on the Quality of Life radio show put on by Owen Insurance Group of Stuart, Florida. I'm your host today, Tom Bouvier. Gary Owen is out of the office today on business, and I have Bill Bedwell with me, who joined me last week, and we started on some really cool topic about Medicare, different mistakes to avoid, differences between Medicare and Medicare supplements and Advantage plans and a few other things. And even if you're not on Medicare, you may know somebody that is. So have them tune in. You're listening to us on WSTU 1450 AM or WPSL 1590 AM. And if you missed last week or any of our wonderful programs, you can go to Facebook, type in Quality of Life Radio Show, and you can listen to some of our pre-record or our recorded presentations or radio show over the last several years. Bill is the director of our sales and marketing here at Owen Insurance Group. I'm one of the field managers and local agents as well. So, Bill, tell us a little bit about why we do this show.
All right, so there's several segments to our half-hour-long show. First, we're here to bring relevant content to our listeners, which means information you can use in your life.
Do you think that information we shared last week is something people can use?
I think so, absolutely.
Yeah, especially if they're going on to Medicare, right?
Right. If they're brand new, yeah, absolutely.
Yeah, you don't want to miss this show. And again, if you can't listen in on the entire thing, go to the Facebook page and you can re-listen to it or send your friends there. Secondly, we always share a quote of the day. Bill's going to share that here in a moment, which is sure to inspire you to action. And we present information that's important regarding insurance planning. We believe in straight talk, transparency. We teach you about the pitfalls to avoid, the agents to avoid, the 1-800 number, call centers to avoid. I mean, so many traps out there. Believe me, we know them all. Bill and I have been well acquainted with this industry. We have many years combined about Medicare, and we know the good, the bad, and the ugly. And here at Owen Insurance Group, we believe in good old-fashioned straight talk, the no plop zone, as we call it. But this straight talk will help you and help enhance and improve your quality of life, because our mission at Owen Insurance Group is what, Bill?
To simplify insurance planning so you can enjoy the stress-free life you deserve.
Absolutely. And go ahead and give us the quote of the day, if you don't mind, sir.
Will do. You don't get results from focusing on results. You get results by focusing on the habits and behaviors that produce results.
Isn't that the truth? I mean, the only reason you should be focusing on the result is if you're picturing the end result. That's but right. Then you really need to focus on those individual steps, habits, behaviors that produce the results that you want. If you want to learn how to play trumpet, give Bill a call. No, but you don't focus on being Branson Marsalis or Bill Bedwell or any other famous trumpet player. You focus on practicing your scales and just your improvisations and listening to good trumpet players and getting there and doing it.
The habits of good trumpet players and the behaviors, absolutely.
That's right. Yeah, exactly. Focus on and imitate those habits and behaviors, and you'll get the results you want. So last week we started on a two-part topic going over 5 things to consider during the Medicare's annual enrollment period for Medicare Advantage and Part D recipients, top 10 mistakes to avoid. And we got through a good portion of it, but we're going to continue on. And I'll go ahead and start. Should I stay on original Medicare Part A and B and just pick up a Part D prescription drug plan? Well, a lot of people think that once they get their red, white, and blue card that they're set. They don't realize that if you only have Medicare, you don't have a supplement, you don't have a Medicare Advantage, you just have Medicare, and maybe you do have a drug plan. That means your drugs would be covered, thankfully. However, with Part A, which covers inpatient hospitalization, skilled nursing facility, blood and other such things, that if you were to go in the hospital, you would immediately have a $1,600 deductible. Every 60 days, you would have that. So 2 or 3 times a year, you go in the hospital, and there's a 60-day period in between. You're going to put out of pocket $1,600 right off the bat. Once you go to the doctors for Medicare Part B, you pay the first Part B deductible. This year, it's pretty low, $226. And then after that, you would owe 20%. And that's where a lot of people think Medicare covers 20%. That's where the idea comes from. However, there's no maximum out of pocket. There's no ceiling. If you have a catastrophic year, you could owe not just thousands, but hundreds of thousands of dollars, because 20% of $1 million is $200,000. Right. And believe me, medical bills have gone into the millions for people. So this is something you need to consider. You give us a call at Owen Insurance Group. We will help you decide whether it is best to just stay on original Medicare or not.
I mean, think about how many times you could end up back in the hospital that year.
You could.
You know, several times. One thing leads to another, right?
Yeah, and once you get out of the hospital, you normally have follow-up visits. You might have therapy. Sure. You might have chemotherapy, you know, many different things.
Yeah.
All right, and the next one?
So the next one is I don't take prescriptions. Can I decide to not enroll so I don't have to pay a premium? Well, it's going to matter on a couple of different levels. First of all, even if you don't take prescription medications, if you don't have a plan that's equally accepted by Medicare as being Medicare level, prescription drug level, okay, you likely will end up having to pay a fine for not enrolling into that plan.
Absolutely.
For not having a Part B plan. And of course, we're going to talk about the reasons why you should have Part D plan or not, and when you can do that. But the fact is that if you're on just straight Medicare, you're not with an employer group, or you're not getting your prescription medications from the VA, yes, you should probably have a prescription drug plan.
Even if you don't take medication.
That's
I mean,
right.
How many people have you and I talked to? They say, well, at age 65, I got a supplement and I got my Medicare, but I never got a drug plan because, frankly, I don't take any medication. I don't believe in medication. Well, now they walk into our office at age 72, 7 years without a drug plan. They don't have VA drug coverage, which could be considered credible coverage. And now they're going to have 7 years of penalties,
right.
As Bill said. It's called late enrollment penalty. And for every year, for every month, it's 1% of the national cost of a drug plan. And so you're adding that on top of your premium. So you don't believe in drugs, but there's a life-saving drug you have to take, and you're scrambling to get a Part D plan because the drug is so expensive. So it's best to do the right thing in the beginning, get it right the first time. Right. All right. So number 5, I'm not working. Should I stay on my employer plan or enroll in Part B and get some other secondary supplement or MAPD? So if you're still working, if you're with a company with fewer than 20 employees, most likely they will require you to enroll in Part B. So that way you'll have Medicare Part A and Part B. Therefore, Medicare is primary and the group plan is secondary. If it's companies over 20 employees, there's other rules apply, and you can certainly give us a call. But we help look at all the different facets of whether you should enroll in Part B or not if you're still working. And again, that's a free service with Owen Insurance Group. You can give us a call, and we'd be happy to talk you through it, educate you, and have a conversation about it, and you can decide what's best for you.
That's right. And next is, how should I choose the best Medicare plan? Well, and what is the difference between a Medigap supplement and an MAPD plan? So how to choose the best Medicare plan? The best thing I can tell you to do is to sit down with an independent agent.
I was hoping you were going to say that, and I knew you were going to say that, but that's the right answer. Doesn't cost you a thing.
Yeah, just make sure that you sit down with someone that an independent agent is it, and let's make sure to clarify this. An independent agent is someone who represents multiple different companies, not just one. So they're not. So they're, an independent agent can be biased, and they can look at all the different things that are available to you, and give you what you find is the best track for you to take. Okay, not the best track that I want you to take.
That's right.
It's not the best track that any that any agent out there should be telling you to take. It's the track that you need to take. What's important to you and your needs. So how should you choose the best Medicare plan? Simply just by making sure that you reach out to an independent agent that can walk you through it. There's so much out there that it can get confusing. You have to be able to trust who you're working with. So we can help you with that.
I certainly agree. And there is a big difference between the Medigap, the supplement, MAPD. We're going to get into that a little bit later here in the show. And can you switch from an MAPD, Medicare Advantage prescription drug plan, to a supplement plan later on in life? The answer is yes. However, there's a caveat. After a certain period of time called guaranteed issue window of opportunity, you would have to answer approximately 10 to 11 health-related questions. This is called underwriting. In the past 2 years, have you ever had this, and this? No. Do you have this condition? Yes or no? No. In the past 5 years, have you ever been told or take medication for this, and this? Yes. If you say yes to any of those 10 questions, we call them in the insurance world knockout questions.
Yeah.
We can't even submit the application. We won't submit the application. We'll be rebuked if we submit the application. Yeah. And so you can switch from a Medicare Advantage to a Medicare supplement later in life if you can pass the underwriting questions, or if you're in the open guaranteed issue enrollment period, or there are a few states in the country that have guaranteed issue year-round. People can switch, but the premiums are much higher.
Yeah, that's why it's best to, and when you're going into this, looking at this and turning 65, that turning 65 is probably the best time that you can possibly get into a supplement plan.
That's right. Or if you get Part B after having delayed it by being an employee, you also have that guaranteed window. Okay, and the next?
And the next one is what is the difference between IEP, SEP, AEP, and OEP? Well,
be quick on those.
Yeah.
IEP
is your initial election period, and I put that down as I eat pills.
I eat pills. That's right.
It
includes prescription drugs.
It includes prescription drugs. That's the time period where you can enroll into those plans. And SEP is a special election period. That's when you can change plans or enroll into a plan that is outside of the annual enrollment period, and you need to talk to an independent agent to make sure that we can pull those special election periods to find out whether or not you can change right
What
now.
is one of the most common one we see here in the state of Florida?
The most common, move.
Yeah, that's right.
If you move,
change in residence.
Yeah, change in residence is probably the most common SEP that we have there.
Okay.
Absolutely. Or the fact that maybe you got on low income subsidy or Medicaid to that effect. That gives you a special election period. There's many of them out there, so make sure that you talk to one of those. And then there's the annual enrollment period, which we're talking about right now, coming up on October 15th.
That's right.
The annual enrollment period is when you can make any change you need to make right at that time period, okay? Mostly for Medicare Advantage plans, prescription drug plans. Make your changes during that time. And then there's OEP, the open enrollment period, from January 1st until March 31st, which is that time period where, for instance, if you enrolled into a plan and you just started using it and it wasn't working out well for you, you have the opportunity to make that one change for the upcoming year.
Excellent. And now, if I'm on Medicaid, do I need to enroll in a Medicare plan? Well, the cool thing about it is that Medicare and Medicaid benefits can work together or be an advantage to you. There are different levels of Medicaid. So depending on the level of Medicaid, if you're full Medicaid, or if you're just a partial Medicaid, it does make a difference. So again, talking to a licensed agent who specializes in Medicare, they can check your qualification with the state Medicaid.
That's right.
And they can advise you as to whether you should get on a Medicaid plan. These are called dual plan. Dual meaning two. You have both Medicare and Medicaid, and they have some really good Medicare Advantage plans that combine both of those qualifications or eligibilities.
That's right.
Okay, so give us a call, 772-210-1020, and we'll help you answer that question in a knowledgeable fashion.
Right. Then the last one here on the list is, how do I choose the right agent or agency to work with? Well, that's a simple one for me, really. I mean, you just give me 772-210-1020.
Absolutely. And we also have a nonprofit organization that reaches across the country to help educate people. It's called MedicareJourney.org. Go ahead and check out MedicareJourney.org. We do have agents that we're continuing to enroll and put on that website where you can find a local agent in your area. But keep in mind, even if you're not in the state of Florida, Owen Insurance Group is licensed in over 40 states. So we have almost every state where we can actually do business, educate people, enroll people. We have agents in specific agents in Texas, California, South Carolina now. I have an agent in South Carolina. We have some up in Virginia. And again, of course, the state of Florida. But give us a call. We are a great agency. We'll give unbiased information and treat you with respect and have a conversation and not just try to push you into a plan. We never sell anything. We educate, and then if we find it's the right plan for you and you find it's the right plan, we enroll you. That's how we become your agent. So we're going to go through this rather quickly, the 10 common mistakes. We just have about 9 minutes left on our show. The 10 common mistakes to avoid with Medicare. Number one is not signing up for Medicare when you're first eligible. Okay, because if you don't get Medicare Part A or Part B particularly, and you don't have credible coverage, you will pay a 10% penalty for each 12-month period that you have when you could have had Part B, but you didn't. I have a couple now who are having to wait till January to enroll in Part B. They're going to have Part B for February, but she's going to have approximately 2 years of penalties, about 20% added to her $164.90. So if she was exactly 2 years without Part B, instead of paying the monthly premium of $164.90 for Medicare Part B, it'll be $197.88. So that's a 20% penalty. That's with them forever. And so another individual is 4 years out. So they're going to have 40% added to that.
And this is why we do this.
This is why we do this. We want to educate you. Don't neglect getting Part B when you first can, unless you're covered by a group coverage that has credible coverage, and the VA benefits is considered credible. So several other penalties I don't want to get into, but prescription drugs, if you don't get a drug plan, as Bill was saying, Part D penalties accrue 1% per month until you sign up. It's added to your Part D premium, etc. So, number two, what's another mistake to avoid?
Not taking advantage of the annual enrollment period. Consider the annual review. When you get your annual notice of change, that ANOC letter that comes in the mail, make sure to review that information. If you're on a PDP or MAPD plans, they change every year. PDP formularies changes. Plan benefits changes, MOOPs change, deductibles change, copays change. It's not a set it and forget it kind of thing, guys. You have to remember that. The MAPD plans can change every year. And the reason why? Because there's so many of them, and and everyone's working the deal. So understand that there's multiple changes that can happen every year. It can come down from CMS. It can come down from just about anywhere that helps make those changes
absolutely
possible.
So get with your independent agent. Hopefully, it's with an insurance group. But if you have an agent that you're working with, make sure they're independent. If they're working for just one company, I mean that's good and all, but they can only show you one plan. They can only show you one company's plans, maybe 2 or 3 plans within their structure, within that carrier's offering. But an independent insurance is able to look at the whole scene, all the Medicare plans out there, and find out. Now, also not understanding the difference between Medicare supplements and Medicare Advantage plans. Many people say, oh, I have a supplement, and they show me their card, and it's an HMO.
Right.
It's a PPO.
Yeah.
That's not a supplement.
Not the same thing.
No, it's not the same thing. So we're going to explain that here in a minute, if we have a few minutes. But and I'll do the next one again, and then you can do the next 2, Bill. But if you're on a Medigap plan, Medicare supplement, be sure it's the right plan. Rate stability, etc., and an annual review for your prescription drug plan. So even if you're on a Medicare supplement plan and you move in from another state, or you want to see if there's another carrier with a lower premium, better service, better customer service here based in the United States, etc., give us a call. You may have to answer some underwriting questions, and if you do qualify, we can switch you over. Okay, Bill?
Next is not understanding your rights to switch plans and knowing when to switch. I actually teach classes on this to agents about special election periods. Can you switch during the annual enrollment period, OEP, or if you have an SEP, or an AEP versus an OEP doesn't affect Medicare beneficiaries with a Medigap plan. So the thing is that you have to understand there's rules that are accompanied with these plans, and you have to know your rights. And we'll make sure that we take care of that for you. Now, the next is delay purchasing a Medigap plan after 6 months.
The guaranteed issue.
The guaranteed issue, right? You have to qualify with underwriting after that point, okay? And then there's number 7.
Mm-hmm. Go ahead.
Not understanding your MOOP costs, your maximum out-of-pocket. Okay, you're going to want to know what that is for the year. Right?
You do.
There's a big difference between $7,000 and $3,500.
There is, and especially if you know you're going to have some medical bills, you've got some procedures to take care of. There are companies with very, very low MOOP, maximum out-of-pockets. Also, not taking advantage of LIS. That's low-income subsidy, extra help for Part D, your prescription drug costs. If you have high prescription drug costs and you qualify, meaning you as an individual make $21,870 annual yearly income or less, or $29,580 for a couple, and your resources, money, stocks, bonds, not your homes, does not exceed $16,600 or $33,000 together with a spouse, you could qualify for extra help. This is help with your prescription drugs, and not knowing what's not covered under original Medicare. Long-term care is not covered. Dental, vision, and hearing aids are not covered. Dentures are not covered. Acupuncture. Well, actually, this year they brought in acupuncture. And lastly, not working with an independent insurance agent or brokerage. So we just have about 3 minutes left, I believe. So, Bill, we're going to take about a minute. Explain Medicare Advantage plans, if you wouldn't mind. Just what is a Medicare Advantage plan?
Medicare Advantage, and the reason why they use the term Advantage is because it encompasses what Medicare already has. They have the Part A and Part B, right? But you are turning that now over to an independent insurance company, right? And they're going to cover that Part A and Part B, but then now they're also going to add on some additional things like dental, vision care, right? Maybe some over-the-counter extras, things like that. So in a Medicare Advantage plan, and the reason why they're advantages is because a lot of times they come with a $0 premium.
That's right. The price is right.
The price is right, right? The maximum amount of pockets, they range.
There's a cap on what you spend.
That's right. So they come in and low up to $7,000, but I've seen them as low as $2,000. And it just really depends on the plan that you're looking at. So you have those, and then you also have the additional of prescription drug plans that come with it. Okay, so that's that little bit of additional cost that you're not having to put out because it's part of the plan.
And that's the Medicare Advantage plan.
That's the Medicare Advantage.
So a Medicare supplement is simply this. Medicare is your insurance. You get your red, white, and blue card, Part A, Part B. You add a separate prescription drug plan, and if you want dental and vision, you'll add that as well. But then you'll add a supplement that will help cover the cost, that Medicare. So there's advantages to both, as Bill was talking about, the Medicare Advantage versus the Medicare supplement route. It's like two paths you can go by. So you say, which is the best, Tom? Well, that's a trick question. It all depends
on your needs.
Your needs, wants, desires, budget, etc. So that's why we're here at Owen Insurance Group. We're an independent, unbiased, highly trained, licensed professionals who are your guide with Medicare. So give us a call at 772-210-1020. It's amazing how fast these shows go. I hope you learned something. Please tell your family and friends every Tuesday morning at 10 a.m. for just 30 minutes. Sit in and listen. Great information. Share us with all your family, friends, neighbors. We want you to be safe, keep healthy, be happy, and enjoy your quality of life. And remember, we're just a phone call away. Owen Insurance Group, 772-210-1020. Stay tuned to this dial because up next is the Brian Kilmeade Show. Have a wonderful day.